Ovvijament nixtieq nirringrazzjakom personalment tal-partiċipazzjoni tagħkom f'din il-konferenza. It didn't go unnoticed fil-verità għax kelli ħafna positive feedback ukoll għal fatt li aħna bħala delegati u per capita biżna ir-rekord ta' kull konferenza li qatt organizzaw issa dina 23 waħda sewwa li qatt organizzaw Alzheimer Europe. So nixtieq nirringrazzjakom ħafna tal-kontribut tagħkom għax nemmen li ħafna minnkom qegħdin hemmen barra, intom first contact person, tintaqgħu ma' din il-kundizzjoni kuljum, tmissuha bidejkom, sewwa kważi nejra likom, jiena xina m'għandix il-kuntatt li għandkom intom u naturalment hija xi ħaġa sabiħa anke għal Malta li konna konferenza ta' dat tip l-ewwel darba li qatt konna konferenza ta' dat tip hawn Malta u li mmorru daqshekk tajjeb nirringrazzjakom personalment. Li se nipprova nagħmel f'dis session forsi kif tafu dal-aħħar f'Lulju li għadda ta' din is-sena stess l-awtoritajiet appuntawni bħala National Dementia, National Focal Point on Dementia. U parti mill-xogħol tiegħi se jkun li nagħmel reviżjoni tal-istrateġija li kellix naqsam anki jiena flimkien ma' ħafna minnkom biċċiet minnkom qegħdin hawnhekk biex nagħmel reviżjoni tagħha. U ma jistax ikolli opportunità aħjar biex nintaqa' ma' grupp daqshekk kbir ta' nies li jistgħu jtuni feedback daqshekk importanti u allura dan il-feedback jiena nkun anke nista' indaħħlu bħala kummenti tagħkom fl-istrateġija. Li se nagħmel però sentikom naqra briefing ta' fiex x'għamilna u fiex wasalna u mbagħad ħaniftaħ għad-diskussjoni u nixtieqkom ħafna tikkontribwixxu fid-diskussjoni tagħkom. X'qed taraw ħażin, x'tixtiequ taraw tajjeb u x'tixtiequ taraw f'din l-istrateġija li hopefully għandha tiġi pubblikata sal-aħħar tas-sena d-dieħla. Mela ħanibda billi ngħidilkom is-slides ħajkunu bl-Ingliż just in case there are people here who are English speaking only. The slides will be in English but mostly I will do my talk in Maltese. L-ewwel mistoqsija li tiġi ġo rasek hija għaliex hemm bżonn li jkollok strateġija in the first place u għaliex għandek bżonn l-istrateġija issa. Ir-raġuni hija ovvja. Min studji li konna għamilna u pubblikajna fit-2007 ħarisna daqsxejn lejn kif se tkun il-popolazzjoni hawn Malta viżavi dawk in-nies li qed jikbru u għandhom ċertu età. U sibna li bejn wieħed u ieħor 15% tal-popolazzjoni bħalissa jew għandha 65 sena jew għandha iktar minn hekk. Naturalment dina it-trend ħad kompli tikber u ħad wassal sa 30% kważi 30% sas-sena 2050. Aħna nafu wkoll li wieħed mill-iktar, anzi l-iktar fattur riskjuż fid-demenzja hija l-età. Dak li aħna nsejħulu non-modifiable risk factor x'ma tistax tibdlu. Tikber trid, ma tistax ma tikberx, naħseb kieku kollha nażlu li ma nakblux. Imma tikber trid u allura xi riskju ħajikber miegħek l-ammont ta' individwi li għandhom id-demenzja wkoll ħajjistennew li jikbru wkoll fil-fatt jekk ħarsu naqra lejn il-lemin issibu li bħalissa bejn wieħed u ieħor għandna 6,000 ruħ li għandhom id-demenzja imma daw ħajjikbru u se jkomplu jikbru il-qudiem u ġie kkalkulat li sas-sena 2060 3.6% kważi 4% tal-popolazzjoni hawn Malta ħajkollha d-demenzja. Hija figura daqsxejn giddieba ikolli ngħid għax kif tafu tajjeb intom ukoll għal kull persuna li għandha d-demenzja dejjem għandek 3 persuni oħra li qed imissu magħha direttament. Qed imissu magħha direttament, jiġifieri they are feeling the effects of it directly. U jgħaddu anke minn perjodu stressanti mħabba fek. Mela fil-verità, meta qed titkellem fuq 14,000 ruħ fis-sena 2060, ma tkunx qed turi l-istampa ċara. Fil-verità tkun qed titkellem fuq 50,000 ruħ li b'xi mod jew ieħor se jkunu qed imissu ma' din il-kondizzjoni. Minu carer hawnhekk u hawnhekk hawn il-carers jafu x'jiġifieri tmiss ma' din il-kondizzjoni direttament u x'effett fiżiku tħalli fuqek u x'effett psikoloġiku tħalli fuqek. Imħabba li din qed tirrappreżenta problema kbira għaw Malta, mhux hawn Malta biss anke barra, però aħna qed nitkellmu fuq is-sitwazzjoni Maltija. F'Mejju tal-2009 il-Dipartiment tas-Saħħa nieda dak li sejjaħlu il-Malta Dementia Strategy Group. Li l-għan prinċipali tiegħu kien dawn kienu grupp ta' nies ġejjin minn oqsma differenti, però li kollha immissu ma' dil-kundizzjoni. L-għan prinċipali kien li jiżviluppa serje ta' rekomandazzjonijiet li fuqhom għandha tiġi infassla l-Istrateġija Nazzjonali għad-Demenzja għaw Malta. U kellu diversi xogħlijiet x'jagħmel, waħda minnhom kienet hija li jistudja s-sitwazzjoni kif inhi fil-preżent. Ma konniex nafu assolutament kważi xejn jew l-informazzjoni li kellna kienet frammentarja ħafna. Min jaf biċċa hemm, min jaf biċċa hawn. So parti minn din minn dan ix-xogħol kien li nistudjaw is-sitwazzjoni, wara nistudjaw is-sitwazzjoni nikkonsultaw man nies li qegħdin hemm barra u wara nikkonsultaw nagħmlu dawn ir-rekomandazzjonijiet u dawn ir-rekomandazzjonijiet saru fil-verità u d-dokument ġie ppreżentat f'Jannar tal-2010, ġifieri ħajala kważi 4 snin issa. Xrajna, għax importanti ngħidu xrajna. L-ewwel ħaġa importanti li rajna hija a significant lack of awareness, nuqqas ta' għarfien enormi. Imma mhux fil-pubbliku ġenerali, dik hija xi ħaġa tistennija meta tqis li aħna bdejna nitkellmu fuq id-demenzja qisu dawn l-aħħar 8-7 snin. Però rajna nuqqas ta' għarfien fin-nies li suppost għandhom, it-training fin-nies li suppost għandhom l-għarfien adekwat fil-healthcare professionals. Aħna nafu kemm importanti l-għarfien, iktar ma tkun taf fuq il-kundizzjoni, iktar għandek ċans li tuħu azzjoni. X'rajna iktar? Rajna nuqqas ta' support psikoloġiku kemm għal nies li għandhom il-kundizzjoni imma ħafna iktar importanti xi kultant għand dawk in-nies li qed jieħdu ħsiebu. Ma ninsewx li persentaġġi għolin ħafna, 60% u aktar ta' dawk in-nies li jieħdu ħsieb persuni bid-demenzja imħabba demand kbir li hemm fil-caring, fl-aħħar mill-aħħar ħaj jispiċċaw ibagħtu huma b'xi kondizzjoni mbagħad. Di kondizzjoni li għandha x'taqsam ma' pereżempju depressjoni, jew ansjetà kbira, jew guilt feeling, jew breakdown. Min jieħu ħsieb persuna bid-demenzja jaf kemm tqatta' ħin ma' din il-persuna u kemm għandha burden, kemm psikoloġiku u ovvjament fiżiku. Din il-kwotazzjoni hija minn studju separat li sar ukoll hawnhekk hawn Malta fejn ipprovajna naraw il-carers xi jħossu, x'inhuma l-esperjenzi tal-carers u fejn għandha x'taqsam nuqqas ta' support psikoloġiku kellna din it-tip ta' kwotazzjoni partikolari li tiddiskrivi is-sitwazzjoni li jkunu għaddejjin minnha daw li jkunu qed jieħdu ħsiebhom. I feel obliged, I feel so guilty. Bħa speċi li l-kundizzjoni ġiet fuq il-persuna imħabba fija mill xi ħaġa ħażina jiena. I can get away from that, it's terrible, I can't even live my own life. I really wish I could run away, but I can't. I can't even live. She has trapped me, really. Tara ċertu ammont ta' uġieħ psikoloġiku. Naturalment m'għandniex għalfejn nispjegaw ħafna fuq għadi there is lack of financial support at all levels, tista' tgħid. Ħafna minn dawk li jieħdu ħsiebhom, speċjalment jekk ikollhom ċertu età, jippreferu jifqu mix-xogħol biex ikunu jistgħu jduru għal ġenituri tagħhom, ħafna drabi ġenituri tagħhom jew inkella l-mara tagħhom jew ar-raġel tagħhom. Dena tikkrea ħafna sitwazzjonijiet finanzjarji negattivi, ġili kun hemm sitwazzjoni fejn minn żewġ salarji f'daqqa waħda tmur fuq salarju wieħed u problemi ta' daw it-tip. Hemm limitazzjoni ħafna fejn għandhom x'taqsmu mediċini li jingħataw b'xejn, bħalissa fil-verità mediċina waħda biss tingħata b'xejn. Ir-rekomandazzjonijiet kienu li jingħataw l-erba' li huma, ir-raġunijiet għalfejn għandna mediċina waħda ma nafhomx bil-preċiż, ma kontx involut f'dak il-proċess jien, però naħseb li is-sitwazzjoni finanzjarja li għaddejja l-Ewropa in ġenerali u naħseb li anke Malta, għax aħna maħniex ngħixu waħedna, naturalment dik effettwat xi ftit. ukoll. Imma din hija xi ħaġa tal-mediċini u nies professjonisti hawnhekk jgħidulkom ħafna iktar minn li nista' ngħidilkom jien kemm ikollhom requests għaliex dawn il-mediċini mhumiex b'xejn. Naturalment dawn il-mediċini mhumiex b'xejn min-naħa tal-gvern, però tista' tixtrihom mill-komunità u nafu li jiswew ħafna flus. Tant jiswew flus li ħafna nies jippreferu ma jixtruhomx għax naturalment ma jkunux jistgħu ilħqu ma dawk l-ispejjeż. U hemmhekk kwotazzjoni oħra minn dan l-istudju li qed insemmilkom li sar hawn Malta bl-għajnuna anki ta' esperti barranin. Hemm nuqqas tal-infrastruttura, m'għandniex a proper dementia homes, għandna dementia wards imma m'għandniex a proper dementia homes. Ħafna mill-structures li għandna li fihom issib persuni ta' ċertu età mhumiex dementia friendly. Ħafna drabi li jiġri persuna tidħol f'residential home mingħajr ma jkollha l-ebda tip ta' problemi kognittivi, però mbagħad jgħaddi żmien tiżviluppa lek id-demenzja u l-ħaġa li tista' tagħmel kważi tista' tgħid li taqlaħħa dik il-persuna minn ambjent li tkun drat u titfaħħa f'ambjent ieħor li jkun kompletament ġdid għaliha u li ovvjament qed issib problemi biex titgħallmu. Mela l-aħjar huwa li jkollok l-istrutturi jkunu ġiġa dementia friendly. Fihom u ma fihomx persuni bid-dementia. Barra minn hekk meta tqis strutturi li huma dementia friendly awtomatikament ikunu senior citizen friendly ukoll ħafna drabi. Sfortunatament hemm nuqqas kbir ta' riċerka fid-demenzja. L-istudenti tagħna nibża ħafna li mhux se jkunu ippreparati ma' din xi ħaġa din il-bomba li ħadd tisplodi dalwaqt hawn Malta. Naturalment in-numri huma kbar u nibża ħafna li mhux se jkollna studenti li huma preparati biżżejjed qed nidu studenti healthcare professional nurses tobba spiżjara, għamilt studji mal-ispiżjara, għamilt studji mat-tobba jien u sibt nuqqas kbir ta' għarfien anke fuq livell bażiku ta' tagħlim fejn tidħol id-dementia. Barra minn hekk naraw ħafna fragmentazzjoni fil-preparazzjoni ta' dawn in-nies, anke aħna lecturers ħadd ma jaf eżattament min qed jgħallem xiex u min qed jgħallem il-min. Hemm ħafna repetizzjoni ta' informazzjoni, ħafna informazzjoni hija outdated, id-dementia huwa suġġett li kważi jinbidel inħin kollu. Għad nies li għadhom jippreżentaw materjal li llum il-ġurnata huwa materjal li spiċċa kompletament sfortunatament. Hemm nuqqas kbir kif tafu biżżejjed ta' servizzi fil-komunità li huma targetjati għal persuni bid-dementia. Xi hawn servizzi fil-komunità li huma targetjati għal persuni li għandhom ċertu età. Qed nuża di terminoloġija persuni ta' ċerta età illum il-ġurnata il-kelma elderly qed tinqata kompletament. Illum il-ġurnata m'għadniex nirreferu għal dawn in-nies bħala elderly imma bħala senior citizens. M'għadniex nitkellmu fuq persuni li jsofru bid-dementia, patients that suffer from dementia or demented patients. Di huwa terminoloġija assoluta tittinqata kompletament, tużawiex tnaqqas ħafna mid-dinjità tal-persuna, a person with dementia, a person with pulmonary disease, a person with diabetes. Biżżejjed dik il-kondizzjoni. Għax awtomatikament meta inti tagħti ċertu isem tkun qed tittimbra fl-istess ħin il-pazjent, l-individwu, u tkun qed tittimbra wkoll il-familja ta' l-individwu. Ma ninsewx li għad hemm ċertu stigma, għad hemm ċertu tabu mhux fuq il-persuni biss imma anki fuq il-familja tagħha. Iktar ma nittimbraw, iktar dawn in-nies jingħalqu fihom infushom, jiżolaw lilhom infushom u joħorġux barra u jitkellmu. Apparti li studjajna daqsxejn x'għandna, studjajna rajna wkoll x'jaħsbu l-stakeholders, nies li jmissu ma' din il-kundizzjoni partikolari, identifikajna 5 stakeholders, inkluż di stakeholders li għandhom x'jaqsmu mal-edukazzjoni, inkluż anki persuni li huma involuti in tertiary education, l-università, long-term service providers, professional bodies, tkellimna ma' unions ta' tobba, unions ta' l-ispiżjara, nurses, etc. Ipprovajna insomma f'kelma waħda nilħqu lil kulħadd. Għax l-idea kienet li nieħdu dak li jissejħa multidisciplinary approach. Nitkellmu ma' kulħadd għax id-dementia hija waħda mill-iktar kundizzjonijiet li għandha faċċata differenti, tinvolvi ħafna professjonisti differenti, tinvolvi ħafna nies differenti, u l-aħjar ħaġa hija li inti titkellem ma' kulħadd għax minn għand kulħadd tista' titgħallem. L-idea hija li d-dementia ma tiġix konsidrata bħala kundizzjoni, bħala marda, imma bħala mudell fejn il-persuna bil-demenzja jiġi impoġġi fin-nofs u minflok u idur ma' servizzi aħna li nagħtu servizzi induru miegħu. Dik li tissejja patient-centered care model. Fejn dak li nagħmlu ikun għal benefiċċju dejjem tal-pazjent. Ikkonsultajna wkoll lill-pubbliku in ġenerali, ddiżinjajna blajnuna ta' nies oħrajn naturalment kwestjonarju li inti stajt tidħol ġo fih online u tara l-idejat tiegħek, kien hemm ċertu mistoqsijiet u tagħti il-feedback tiegħek. Dak kien fuq website partikolari li kien jagħmel mid-Dipartiment tas-Saħħa Elderly and Community Care. Dil-website kellha informazzjoni fuq id-dementia, informazzjoni fuq l-istrateġija u xi links oħrajn inklużi links li għandhom x'jaqsmu mal-Malta Dementia Society u mill-Malta Dementia Society mbagħad tmur fuq links oħrajn ta' assoċjazzjonijiet barra minn Malta li huma għandhom ħafna informazzjoni fuq il-website tagħhom li aħna ma noħolmux biha għax trid ħafna flus biex tagħmilha xi ħaġa hekk. Però meta taqbad l-affarijiet kollha f'daqqa, dawk l-affarijiet li tara, dawk l-affarijiet li tisma', dawk l-affarijiet li jindikawlek in-nies, issib li bażikament għaw Malta għall-inqas 3 huma l-areas li hemm bżonn li wieħed jintervjeni fihom u kemm jista' jkun malaj. Waħda minnha hija l-għarfien. M'hemmx biżżejjed għarfien hemm barra. In-nies ma jafux biżżejjed, għad min għadu jassoċja direttament ma l-fat li inti ħatikber, il-fat li ħatikber bil-fors ħajkollok id-demenzja, allora jgħidu l-ek mux tippretendi dan nannu għandu 75 ta' nannu għandu 80. Meta fil-verita, ħafna iktar anzjani ma jkollhomx id-demenzja mill-li ħajkollhom. Ma imma din l-idea żbaljata tnaqqar ħafna fuq li dik li tissejjaħ timely diagnosis li persuna ma jieħux azzjoni meta suppost jieħu azzjoni. Jew inkalli jieħu azzjoni meta jkun ġiġa tard wisq. U aħna nafu li d-demenzja bħal kull kondizzjoni oħra, iktar ma inti tuħu azzjoni mill-bidu, iktar naturalment aħjar. Għax anke l-options għall-individu u għall-familja mhux huma options li għandhom x'jaqsmu biss mal-mediċina, ma options oħrajn ikunu available għalihom. Area oħra li ta' min ħares li jasewwa hija early diagnosis. Again għandha x'taqsam ħafna mal-awareness li iktar ma jkollok diagnosi malaj, iktar aħjar, iktar tkun tista' tieħu ċertu deċiżjonijiet. Area oħra importanti, naturalment, hija fil-komunità. Li inti kemm jista' jkun tagħti servizz fil-komunità, aħna nafu għaw Malta kemm l-anzjani tagħna għadhom jgħixu bħala parti mill-familja, għadhom jgħixu fil-komunità, jixtuqu jibqgħu jgħixu fil-komunità, huwa tajjeb li jibqgħu jgħixu fil-komunità. Post fejn huma trabbew, post fejn għandhom il-ħbieb tagħhom, il-kuntatti soċjali, eċċetera. Ma nagħmlux tajjeb li naqilgħuhom mill-komunità. Irridu ngħinuhom jibqgħu fil-komunità, imma biex nagħmlu hekk irridu nofrulhom is-servizzi, mhux lilhom biss anki il dawk in-nies li qed jieħdu ħsiebhom. X'ġara minn dakinhar li poġġejna rekomandazzjonijiet u tajnihom lill-awtoritajiet sal-lum il-ġurnata, sal-2013. Ma ġietx ippubblikata l-istrateġija għalkemm inkitbu żewġ drafts, inkiteb draft wieħed marret għand in-nies rawa taw il-feedback tagħhom, reġgħet marret lura reġgħet ġiet, erġajna tajna l-feedback, eċċetera. Din l-istrateġija sfortunatament qatt ma ġiet ippubblikata. Ir-raġunijiet għaliex ma ġietx ippubblikata jiena ma nafhomx eżatt, però nassumi li kien hemm fatturi differenti, ma ninsewx li biex ikollok strateġija bħal din li kienet se tkopri kważi bejn 5 u 8 snin trid ċertu ammont ta' finanzi, naturalment, tittippjana liha U anki l-fatt li dina ntaqet ma' ħajt fejn kien hawn letteralment meltdown tas-sistema finanzjarja Ewropea ovvjament ma' enix. Però naturalment kien hemm a political commitment dak iż-żmien, però ma kienx hemm naħseb a financial commitment, din hija opinjoni personali tiegħi. Però saru affarijiet pożittivi, kien hemm affarijiet f'dawn ir-rekomandazzjonijiet li saru u dawn huma xi ftit minnhom. Waħda minnhom kienet l-inklużjoni tal-kelma Dementia bħala kundizzjoni kronika fix-Schedule 5 tas-Social Security Act li ġi riformat fit-2012 minn għalija. Fej Dementia l-ewwel darba ġimdim daħla fil-lista ta' dawn il-kundizzjonijiet. Għax hija parti minn din il-lista, setet tkun ukoll inkluża fil-Government Formulary List. Din hija l-lista ta' mediċini, darba mhux kondizzjoni mediċini, li jistgħu jingħataw b'xejn fuq il-National Health System tagħna. Sfortunatament, waħda biss irnexxielna indaħlu, jew irnexxielhom idaħlu. Di ġabitna naqra darna mal-ħajt għal raġuni partikolari aħna l-uniku pajjiż fl-Ewropa li għandna dat tip ta' arranġament. Li għandek mediċina waħda biss. Ħafna drabi fil-maġġor parti tal-pajjiżi Ewropej jew għandhom il-mediċini kollha imdaħħlin bħala b'xejn, jew għandhom il-mediċini kollha sussidjati, il-persuna toħroġ a nominal sum, a nominal fee, u mbagħad il-kumplament joħroġhom l-awtoritajiet. Aħna l-uniku pajjiż issa li ġejna b'dan l-arranġament. Qabel konna wieħed mill-pajjiżi fost tnejn aħna u l-Latvja li ma kenniex das-servizz, issa ġejna l-uniku pajjiż sfortunatament li għandna dat tip ta' arranġament li jiena naturalment ma naqbilx miegħu. Ħaġa oħra li saret u li kienet parti mir rekomandazzjonijiet hija li nibdew niġbru daqsxejn data, analiżi ta' min huma dan nies li qed jieħdu das-servizz ta' mediċini. Allura ġiet ikkreata formola speċjali li inti meta tapplika għal din mediċina biex toħodha b'xejn trid tagħti ċertu informazzjoni. U din l-informazzjoni tintuża biex inti tkun tista' tippjana x'servizzi għandek bżonn il-qudiem. Sfortunatament fejn il-formula tmur ma nafx jien x'fiha ma nafx laqqas, x'informazzjoni tidħol fiha ma nafx naqqas, forsi jekk hawn xi ħadd li jista' jagħti dit tip ta' informazzjoni għalkemm hemm minnha li żgur hija konfidenzjali, però ma nafx kif qed tiġri l-biċċa tax-xogħol. Xi ħaġa li saret ukoll hija pubblikazzjoni ta' żewġ booklets li huma wieħed kien intenzjonat ta' tfal naħseb kemm il-darba ntqajtu miegħu innannu nasa xi simni dak huwa intenzjonat għal persuni li mhumiex adulti huma tfal, jirrakkonta l-istorja ta' żewġ titfal li jintaqgħu mad-demenzja fin-nannit tagħhom għall-ewwel jipprova jkunu daqsxejn konfużi x'inhu jiġri, imma mbagħad bil-mod jibdu jifhmu x'kundizzjoni dil-biċċa tax-xogħol. Mbagħad kien hemm ktieb ieħor li kien jismu x'ħenu li huwa iktar intis għal persuni li għandhom ċertu età. Naturalment nafu hawn Malta hawn ħafna persuni anzjani li qattu ħafna ħin fil-kumpanija ta' xulxin, imorru jieħdu żewġ pastizzi, imorru jieħdu naqate, forsi labu naqa' karti, eċċetera. U jekk ikun hemm wieħed li għandu għarfien biżżejjed biex forsi jinduna x'inhuma s-sintomi li forsi jkunu ħerġin f'xi wieħed minn sħabu, ikun jista' jgħaddilu l-informazzjoni, jgħaddilu l-ktieb, forsi jitkellem, allura dejjem tgħin li persuna jieħu azzjoni kemm jista' jkun mill-ewwel. F'Lulju tal-sena 2013, is-Segretarju Parlamentari tad-Drittijiet tal-Persuni b'Diżabilità u Active Aging appunta National Focal Point on Dementia li xogħlu hija li jipprova jerġa' jqajjem ħaj din l-istrateġija nazzjonali fuq id-demenzja. Sal-aħħar ta' dis-sena huwa ppjanat li se ssir reviżjoni. Ġifieri bażikament l-istrateġija ħadd inqabad u ħadd tiġi reveduta. Ma tantx hemm affarijiet x'tirrevedi fiha, u nħossni daqsxejn stramp nirrevedi affarijiet li ġiġa kont involut fihom qabel. Però Il-pilastri jibqgħu dejjem tlieta. Għarfien, dijanjosi u servizzi. Dawk huma l-iktar affarijiet li għandna bżonn. Jiġifieri għalkemm jista' jsir xi reviżjoni żgħira anke mħabba l-fatt li llum il-ġurnata qed tidħol ukoll teknoloġija assistiva li hija tajba ħafna għal daw il-persuni u ta' min niffukaw anke bħala pajjiż fuqha, il-pilastri se jaqbgħu l-istess. F'Jannar ta' 2014 ħan ippubblikaw Green Paper ħalli di toħroġ hemm barra u kulħadd ikun jista' jaqra x'inhuma bażikament ir-rakkomandazzjonijiet tal-istrateġija. Mbagħad biħsiebna nagħmlu consultation process mal-pubbliku ġenerali, ma' focus group, ma' stakeholders, ma' nies bħalkom, pereżempju, dik kienet sitwazzjoni ideali għalija pereżempju li nara daqshekk nies involuti u allura nista' nieħu l-feedback tagħhom mingħajr ma noqgħod norganizza meetings separati u niġri wara ħafna nies u naf kemm intom impenjati wkoll. Bej wieħed u ieħor f'Mejju Lulju tas-sena d-dieħla ikun hemm il-preżentazzjoni, il-pubblikazzjoni ta' l-istrateġija biħsibu jsir fl-2014 u naturalment l-implementazzjoni tagħha ħed uħud minn snin. Din hija x'nixtieq nara jien. Hemm differenza kbira probabbli bejn dak li nixtieq nara jien u dak li finalment se jiġri. Li nixtieq nagħmel issa f'daw isu 50 minuta li fadal huwa li niftaħ id-diskussjoni għalikom. Ġifieri nixtieq vera feedback minn għandkom. X'taħsbu fuq daw il-punti, daw l-erba' punti partikolari li ovvjament jiffurmaw l-iskanetru tal-istrateġija li naħseb li għandna jkollna. Waħda hija l-arfin, x'għandna nagħmlu biex nżidu l-arfin, x'għandna nagħmlu biex nedukaw u nittrenjaw iktar, x'għandna nagħmlu biex nintervenu ħafna iktar malaj u allura jkollna dijanjosi aħjar, u x'għandna nagħmlu biex nissopportjaw kemm jista' jkun il-komunità. Naf li hawn minnkom li taħdmu anki fil-long term care ikun ideali wkoll jekk ituni feedback fuq dak li ssibu intom meta tuħdu kura ta' dawn in-nies f'bażi ta' long term. Sfortunatament jien ma tantx għandi kuntatt ma' dawn in-nies, allura napprezza ħafna il-feedback tagħkom. Kottuni ċans ħanoħroġ daqsxejn notebook ħanuħu 4 noti. Mark, kellek mistoqsija inti u xek?
Komment, Charles, more than anything else. Il-karta li semmejt inti li wieħed japplika għal donepezil, fil-kas donepezil, because that is what is available at the moment, basikament li fija, just as a point of information, I'm sure a lot of you saw it, but basically, a mini mental state examination, the report of a CAT scan, and we know that CAT scans are not necessarily the most, shall we say, helpful in making diagnoses, because as Charles he intimated towards it. I mean, we speak of dementia, and that's one of the reasons why when I founded the Dementia Society, I said dementia, not Alzheimer's, with respect to Alzheimer's, but there are many subdivisions, classifications are being reintroduced as we go along. Basically, I think it's important to bear in mind for the future, Charles. The other things there are basically the medication people are on, and a repeat mini mental state. But again, I would question that, because a mini mental state is, is a screening tool. So where are we in that department? So if we really need to get, and I agree with Charles, if we really need to get data, I think there's nothing worse than getting vague data. I hear my call Shane, we look on a data which is unreliable. So my issue, Charles, would be certainly to look at that paper again. One of my suggestions would be to look at that paper again to make sure that the data we're collecting is good data. Otherwise, it just goes in. I suspect, Charles, it goes into the pharmacy department, into the main stores, and then
I really don't know where it goes.
It says, but I mean, if anybody knows here and can help us on that.
My information is that probably it goes to the Department of Health.
There we
but
are.
what happens to it and what type of statistics
exactly.
are being carried out and what data is being actually coming out of that, I
Yes.
really don't know.
So really, if we can.
Another important point that you mentioned is this difference between dementia and Alzheimer's disease. The drugs that we have approved are only approved for Alzheimer's disease. But there are other dementias. There is frontotemporal dementia, vascular dementia, of which these drugs usually are not recommended. So there's taħwida hemmhekk għax in-nies ma jistgħux jifhmu u ma naħsibx li qed nedressjaw aħna u intuhom l-informazzjoni ideali laqqas jgħidlek jiena mhux dementia għandi mhux xorta għaliex mhux qed nieħu l-mediċini.
Okay, I have to answer.
Can you use the microphone, please?
Ma nixtieqx li nbidlu suġġett, ħan nitkellmu fuq il-forms.
Tying in with your sort of like, treatment with medication, you have to identify the people early on. And unfortunately, like for instance, the mini-mental test is not a very sensitive test for picking up dementia. There are other screening tools like the MOCA, which might be more sensitive. But also you have to consider, and I think this is a move which you find in geriatrics for sure, that you can't restrict identification of these people who need this kind of medication when they already have a probable dementia. You have to identify them at a possible stage, like when there's a mild cognitive impairment. So you have to also identify ways of identifying them early. Now, I'm a speech-language pathologist, and communication is a higher language, a higher cognitive function, which might indicate possible dementia early on. And I'm sure there are other ways, like for instance, if you're thinking, like the OTs would probably say, instead of waiting till the person is unable to do their personal ADLs, you'd see instrumental ADLs. So you might want to be thinking about different ways of screening to identify people early, to try and help individuals with the dementia. So that's already a lot of work in the pipeline to think about.
I have to answer about this information so that we have some clear things. First of all, in December of last year, the new Schedule 5 drug was added to be prescribed for dementia. Okay, we have one drug, as Charles had mentioned, and for the first time, it was decided by the department to start collecting as well information on people with dementia who are going to start the medication in order to follow up the prescribing of the drug, and also to collect some basic information. The data is kept by the Department of Information and Research.
Where is this?
The Department of Health. And they analyze it, okay? And the information that is collected is demographic information, and as well information that for the first time would give very valuable information about, for example, where the person is living, okay? The diagnosis. At the moment, the drug is specifically being prescribed to people with Alzheimer disease. But separately from that, the department also wants to know that whether there are other forms of dementia as well. So data can be collected on that aspect as well. Besides, with regards, you asked about the mini-mental state examination and that it's a screening tool. In fact, as you are saying, it's only an indication, and the diagnosis obviously is not based on that. And the reason why on the form we ask for feedback on CT scan reports and on SPECT scan is to see what investigations have been carried out. It's obvious that a CT scan does not make a diagnosis of dementia. And the reason for this register is so that people are followed up as well to see how many people with dementia reside in the community, how many are applying and they are resident in a home. And it's the first time that some information like this is being collected.
Just to
with
add another.
Regards to mini-mental state examination, on the application for new drugs, even it's up to 26. So it includes even less than 20, from 13, if I recall well, from 13 to 20 to less than 26. Yes, so it incorporates
but
a wide range of
But then again, the drug that is approved is not indicated for the very progressive form of Alzheimer's disease. It is only recommended for mild
the
to moderate.
deficiency is whether when another drug is required other than the one that is available, and as well for the advanced.
Exactly. And another major problem now is the fact that the section that involves the elderly has changed department completely. So now that goes under the Ministry of Family and Social Solidarity, whereas the medical part remains under the Department of Health, obviously. So there's a need, and I already suggested this to the authorities, of having interministerial groups in this particular condition, because otherwise there will be a department who's deciding something and the other department is deciding something which may be completely different, and there need to be crosstalk between the different departments. So one of the recommendations would obviously be the need to have an interministerial delegation, a group that will discuss exactly what is happening, because you get an information out of this form which gives you an idea of something that needs to be implemented by another ministry, for example. So we need to talk also about that. But please, I would prefer if we concentrate a little bit on the different topics here, otherwise we lose it completely. Let me take this, Anthony, and then I get back to you.
Okay, just a quick sideline. I'm Christine and I'm a neuropsychologist by background. So I guess just to talk about the assessment, I worked in the UK for a long time, and the procedure was that a neuropsychological assessment would be carried out along with the CT scan, because you can differentiate according to the patterns you find in the assessment. So, I mean, it's an easy, for us, it's not a laborious assessment, that it's done routinely within memory clinics. So I don't know if that could be something that we could perhaps look at setting up. I know that the university, we're going to do the masters in neuropsychology as well, so hopefully there'll be more neuropsychologists in the future, and this should be part of routine care, really. So I don't know.
Do you get a neuropsychological assessment in the memory clinic, for example?
No. Abroad, where I worked in Dundee, we used to have a neuropsychologist together with us at the clinic. Unfortunately, at our memory clinics, it is medical, nursing, it's the interprofessional team without input from a psychologist. We have psychologists help within our psychiatrist clinic.
Would you approve to have a neuropsychologist in your team, for example, at the memory clinic? Would there be a good addition?
It is. Exactly, but at the moment, the recruitment of psychologists and neuropsychologists is within the Department of Psychiatry, separate, not part of the geriatric department.
Anthony?
Hi. Anthony? Okay, basically I have two questions and maybe a suggestion. With regards to the strategy, my question is this. When these strategies are usually written down, most of them, they will give some recommendations. Unfortunately, if they are not attached, embedded with a particular time frame, they may be very nicely written, but they will not be implemented. In what way will this strategy be included, will have some form of time frames where a particular intervention will be implemented?
Yeah, obviously there will be time frames attached to each particular recommendation. And another thing, one of the recommendation itself is the formation of this group that will ensure that the various phases of the implementation plan are actually being implemented. This would be the job of a group of people who will actually see that these things are being implemented, that the money is being well spent. That's something completely different. It is a recommendation in itself to have such an implementation group.
So these will be written down in the strategy?
That will be the recommendation will be written down in the strategy. Obviously, these people would be functionaries, government functionaries who will foresee that things are being, hopefully, being done.
Regarding valuing frontliners, because one of the importance in any strategy is, as you said, awareness, education, and training. I do believe, and I know that the strategy was based on an extensive consultation with different frontliners, but the context has changed. There are certain things with regards to prevalence, maybe, with regards to more awareness. We are maybe a little bit more aware, but also with regards to other contextual factors that has changed from 2007 now to 2013. Will there be further consultation with frontliners?
My big problem is this one: whether I should increase or decrease the implementation period to 5 years, or leave it like it is, to 8 years. There are different explanations for these. Abroad, for example, France and the UK, they have multiple dementia strategies. For example, France are in the third dementia strategy. They give it a very short implementation period of 5 years. They fund those 5 years, then they reassess what needs to be done. Mm-hmm. They take also the what worked out in the previous plan, and then have a new plan. With us, I would like to take that particular approach, I have to say. But then again, if I get approval for a strategy, it would be much better for me to get an approval for 8 years than an approval for 5 years, and after those 5 years, nothing will be done. Mm-hmm. So at least I have 8 years. But I still have to decide, obviously I will discuss this with many people, whether we should have an implementation period of 5 years and then work out the second Malta dementia strategy, and then eventually a third and the fourth and the fifth, always taking into account the new advancement in the various fields, or whether we have one, hope we get that one at least, and extend it as much as possible.
May I add something else with regards to suggestions? I think one of the needs, and we're seeing that most of the studies and the projects that were done during this conference abroad were done with the assistance of EU funds. And I think that this is an important opportunity as well for Malta to find resources, and we know that they are lacking, especially financial, but not necessarily even support. And this was an excellent opportunity here, where we could network, but also especially financial, from EU funds. In what way will this happen? Do you think it can be done?
The European does not fund these type of activities. These are things that are funded completely by the Maltese government. The European Union does not fund projects of this type. However, the European Union has projects in which there is collaboration between different countries, so that people from here can go there and people from there can come here, and we discuss things. But the European does not fund. Besides, when the European funds something, it always funds a percentage. The rest has to come from the local government. There are different programs. Some are 60-40, some are 70-30, for example, and some are even 50-50. So that depends on the financial situation of the government, of the department, with respect to that particular project. Most always, when it involves money, we have to unfortunately back down. And you can talk in Maltese also, eh? It would be better if we introduce ourselves first, so that people would know who we are, basically. And then N is one of the individuals who takes a lot of care in organizing activities of the Malta Dementia Support Group. She is an ex-carer. She does a lot of work. Also, Sister Vinnie does a lot of work together with N in organizing these important events.
I used to have problems when my mother was admitted to casualty. I couldn't leave her for a second. Lots of different people coming in. I have to keep explaining. They ask her a lot of questions. I have to keep explaining she can't speak. I would be terrified they try and give her food because she couldn't eat. Every time I speak to someone, she has dementia. She can't answer you. I don't know what people who are not accompanied do, but it is a very big problem in casualty. In the wards, maybe not so. It's not so bad, but people with dementia have to be looked after properly in a hospital.
What would you suggest?
Definitely
that should happen
more
in
training,
acute
but
care?
I suggest that these people they have to be accompanied by somebody or have a nurse with them. I remember one person who had dementia was next to the nurse's station, but it doesn't work because this nurse was going crazy. She had to deal with the whole ward, plus this patient who kept coming out of bed, who was in danger of falling and hurting herself, of putting things in her mouth. I mean, it just doesn't work in a hospital. And we finished up that as much as possible, when she needed treatment, she was given the treatment in the home. We very,
so what
very
you're saying
rarely...
basically is that healthcare professionals who actually are involved in acute care do not have the necessary training, basically, to take care of...
I think it's a matter of time, especially in casualty.
One person
in
at a time.
casualty is a problem. They have so many people, it's very difficult. And also the time, we had to wait for hours. You can't keep a patient like that for hours. It's very, very stressful. I also want to talk about early onset. It's very difficult to get a person who has very, very early onset dementia, very early diagnosis, to get a person to a doctor. So try convincing someone who has just started repeating sentences, telling that person there's something wrong with you, we need to go to a doctor. It takes months. And the doctor also takes a while to understand in that short time he's seeing the patient, what this patient has. Very often the patient starts repeating. When you go to the doctor, the patient would be perfectly normal. So it's very difficult for both the family to understand what's going on and for the doctor himself to understand if the patient answers every question perfectly. So it takes time. One last thing, drug reaction. My mother reacted very badly to one of the drugs. And she couldn't take them. I mean, there's only one drug covered by the government. At the time, we were not covered. The amount of money that my father spent on drugs, practically his whole pension every month. Thankfully, my mother had her own pension, but there is not enough help. People can't afford. I mean, we calculated it cost us over 100,000 with my mother over 12 years. I mean, between 4 people. So those people who are on their own or on a pension, it is just impossible.
Yeah, that's true.
In relation to emergency care, maybe we should be thinking in the future of having maybe acute geriatric care. You know, I think that is important because the emergency department is not I mean, I can understand you well. I worked in Mater Dei. Definitely, it's not, the place where you can see to the problems that arise, especially when a crisis occurs for someone, with Alzheimer's, with the behavioral problems, with the swallowing difficulties and whatnot. So that is something maybe we should consider for the future in the development of acute psychogeriatric
So you would include that as a recommendation,
yes,
for example?
Definitely.
And it should be staffed by whom?
I mean, it has its own. I mean, it does not necessarily have to be...
Multidisciplinary team, probably?
Yes, exactly. Maybe a crisis team, I mean, just like there is a crisis team in geriatric care. It would include as well, persons with dementia and the problems they...
The crisis team does cater for...
But,
It's still, obviously, it's work in progress. But just to say that, yes, there are good projects, and we are working both in the private and the government sector. But obviously, money is also provided by the authorities.
We've been in a lot of discussions to try and convince people in the acute hospitals that the presence of geriatrics is very much
very important. Very important.
And I share these experiences of people with dementia really having a very difficult time being admitted through the lengthy process through A&D. I also had a relative of mine with
There should be
dementia
fast
who
tracking
just
at
needed
least.
a simple opinion, and she was waiting
At
with
least-
a carer there for 5 hours.
At least fast tracking, you know, some way. And another, another question I have is because here, I mean, and even abroad, I had the opportunity to go abroad and with the Alcove project, when they talk about timely intervention, there's a lot of work now being done on advanced directives.
Yeah, I know that.
Is that at all going to feature in the, you know, in the strategy? It's an extremely ethical, you know, sort of.
I would definitely like to include
Yes,
any, even the basic forms of advanced directives.
Exactly.
However, I think we need a discussion on advanced directive
I
on a
think
national
we need,
level
you know,
first,
a very wide
because
discussion.
unfortunately, advanced directives may give completely different ideas of what we have. Advanced
Exactly.
directives are, but probably the people out there are not prepared to discuss these. Maybe they believe they have to do with something else, like euthanasia.
No, it's not that
example,
at
what
all,
they
you
have in
know, I
Switzerland,
mean.
and the system they have in Brussels, in Belgium, for example. And that may do us more harm than actually good. I think the fact that we need to discuss advanced directive is something that has to happen on a national
to evolve
level.
or-
Yeah, but I do agree there's a lot of
There's a
countries now
lot
in
of,
Central
you know, and
Europe
it's-
especially that are very fond of this idea of having advanced directives. I see somewhere there. Do you have anything else?
No, that's.
No, thank
for
you
the
very
moment.
much. Okay. Okay, Marisa, and then Joe.
ċart inti semmejta ħafna l-stress u l-problemi jkollhom il-carers. Kollha nafu li mhix easy li toħsib anzjan dementia 24/7 hija stressful ħafna. Jiena minn ħafna fis-servizz ta' support into community. Ma nafx xogħol bħala servizz into community imma servizz ta' respite. Jena għadem San Vincenz kull manna b'kollox 7 sodot ta' respite u 2 oħra fit-dementia wards. Għalija huwa servizz minimu ħafna, mhux qed inlaħqu mad-demand li għandna. U relatives li għandek dik il-15 break meta l-individwu bid-dementia jidħol għal-respite, dak li jkun jerġa' jiċċarġja il-batteries jista' jsifer, jista' jieħu dak il-break bżonn biex jistrieħ mill-istress tal-kura li għandu bżonn anzjan dementia. Da servizz ta' respite ħajkun inklud fil-dementia strategy.
Respite care is extremely important because we know that respite works. And unfortunately, there's not enough services with respect to respite. But another thing that I would like also to be part of this strategy in terms of community services is a multidisciplinary team. The idea is that following each and every diagnosis, the diagnosis goes to this team, and this team will visit the individual in the community and discuss the various ways with which he can or she can improve or increase the quality of life. And this has to do not only with care, but also things that are there in the environment, like the use of colors, the use of signage, etc. Things that people that they don't know about. So there will be this team that will be composed of different professionals coming from different areas that will advise continuously in the community, always available. There will be a number. At least we should try and do this and test whether it works or not. Because again, a lot of people want to live in the community, but they need support. And the idea here is this active aging, independent living thing. Joe first, please. Joe.
George,
Sorry,
sorry.
George.
All right. Charles Nelson, Vincent de Paul. As regards to education and training, nowadays the University of Malta Health Faculty has courses in bachelorate and master's level in every kind of nursing. We have community nursing, masters, mental nursing, general nursing. Unfortunately, there's nothing about geriatrics or gerontology, nothing. Does this strategy aim to address this lacuna we have?
The strategy aims to increase the level of education at tertiary level, particularly in healthcare professionals, including nurses, including doctors, and including pharmacists. Our problem, and my main problem, because I lecture at university, is that we focus a lot on the medical model, leaving out almost completely the social model. So we lecture our students what happens in the brain, what cells are affected, what areas of the brain are damaged, etc. Yet, our doctors go out of university not knowing that there's a helpline, not knowing that there are particular services. So we would try to increase this. I would be inclined to do this by probably involving the society in general. That is, different societies that work out there in different conditions, Parkinson, dementia, Huntington, would have a means and a way with which they can interact with our students that will eventually be our future healthcare professionals. But that is an idea, and it's not very easy to get because you need to get approval from the Senate and all this bureaucratic.
May I respond? Just a few, George, to let you know, maybe, probably you know, but I work at the Faculty of Health Sciences, and I'm aware that there is a certificate in elderly care open for persons working, mainly nurses, obviously, that have been working in the setting for over a year. It is available. There are different pathways. There is the elderly care and also rehab. Unfortunately, it has been opened. It's still open. There were about 8 people, and there is a particular study unit who Dr. Abela was coordinating, gave this study unit specifically on dementia care. It was very well organized. I must say, unfortunately, that this was opened, and there were about 8 that were interested and did the certificate. Unfortunately, these past 2 years, it wasn't opened specifically, though it was there, because there were not enough nursing staff, who were inclined to start this certificate. There may be various reasons, I can understand, but resources, training is available. So it's a question of maybe other reasons. Is it managerial? Was it possible that these people there's not much awareness about these courses, or is it the organization? Well, there is the European Center of Gerontology and Geriatrics, but.
I think I would agree. These are really good initiatives, but something a bit beyond something to degree level or master's level.
I think we don't have yet the expertise to start, but I mean, that's the problem. There were very little there were no people who applied really, or not enough, let's say so.
Okay. The lady, okay. Please raise your hand so that I can see you. Okay, one at a time. Okay, please, introduce yourself first.
Roberta, speech therapist, Rehab Hospital Caring Greg. Fuq tal-education, inti semmejt tal-Parkinson's, aħna bħala Parkinson's Association kanna opportunità ġejna mistiedna s-sena l-oħra anka dis-sena biex nagħtu lectures lill-studenti tan-nursing, jiġifieri lecture waħda, naħseb idea tajba forsi anke ntukom il-kuntatt mal-persuna li qed tistidilna biex forsi jkun hemm xi ħadd min-naħa tagħkom jista' jmur jagħti lecture ukoll. Bħala support inti community, aħna Rehab Hospital nagħmlu l-memory classes għan-nies li għadhom jgħixu fil-komunità u dan fuq span ta' 12 weeks. Naħseb xi ħaġa li forsi għandna nikkunsidraw anke bħala f'dawn il-memory classes li fis-sena li ġejja anke ta' wara nibdew ninvolvu l-Malta Dementia Society biex ukoll huma jkollhom forsi session matul dawk is-12 ġimgħa ħalli jkunu jafu bis-support ukoll tas-society in-nies li qegħdin fil-komunità. Xi ħaġa li ġara mill-grupp ta' din is-sena hija li l-grupp tagħna baqgħu jiltaqgħu waħedhom, jiġifieri ħassew il-bżonn li jibqgħu jiltaqgħu bejniethom bħala support group. U din naħseb hija idea tajba biex Dan il-grupp ukoll nużaw ħapparti li jien ukoll tajtom l-applications għas society biex jitlu fis-society. Biex forsi nieħdu l-idea li l-biroħ ukoll smajna biha tal-Alzheimer's Cafe li jkun hawn dat tip ta' kafe għan-nies li fejn jistgħu jmorru drop-in center, forsi jistgħu nużaw id-day centers. Ma day centers ġemmu mhix qegħdin jikkejterjaw għan-nies li għadhom fil-community. Forsi f'ħin separat jekk ma jixtiequx li jkun hemm nies b'dimensja minħabba ovvjament raġunijiet ta' kif ħajmaniġġjaw lil kulħadd f'daqqa, jista' jkun li day centers fil-ħinijiet li jgħalqu wara nofsinhar, forsi jiftħu f'xi ħin ieħor, forsi mis-6 sa 8 eżempju qed nagħtina, fejn jistgħu jkun hemm min-nies kemm professionals kif ukoll anke nies il-carers u nies b'dimensja jiltaqgħu hemmhekk u forsi jkollhom support dak il-ħin. Just an idea. Bħala support il-community.
The idea of using local council structures is a very good one. And that is in the pipeline, not only with respect to dementia, but also with respect to active aging in general. So there will be a drive forward towards using more the local council structures in order to have more knowledge, to increase knowledge among that particular sector of the population. The ideal situation would be that local councils are used as activity centers for individuals with dementia. So we will have plenty of those in the future. But again, in order to do that, you need to increase a lot training of staff that will eventually take care of these individuals in the community. Because one problem that we encounter at the moment is transport. We only have one activity center for individuals with dementia here in Malta. There are a lot of people who really want to use that particular service, but they can't because they don't have transport. And it's not very easy to arrange normal transport for individuals with dementia. Mind you, it's not simple. Apart from that, but it's not simple that you just instruct the driver to go for a person with dementia, and that person with dementia will come. It needs to be targeted. Sorry. No, that's you. I forget the names. I'm sorry.
You're occupational therapist in the Paul. Naqbel ma' Marisa u miegħek fuq il-bżonn ta' respite. L-activity center, per eżempju, ħafna nies li jiġu respite meta tissuġġerilhom il-use tal-activity center li naħseb li huwa bżonn jus ħafna, again il-problema tat-transport u li huwa daqsxejn il-bot per eżempju biex jaċċessaw. Option oħra li hemm u Malta ma tantx ma naħsibx li teżisti hija il-respite in the person's own home. Ħafna drabi il-carer tal-persuna b'dimensja tispiċċa kważi housebound mal-persuna b'dimensja għax ma tistax tħallija waħedha. Jeżisti barra minn Malta jeżisti il-kunċett ta' l-persuna tmur fid-dar mal-persuna b'dimensja sakemm il-carer tista' toħroġ tagħmel għall-menu qadi jew tista' jkollha sija għalija biss. Fuq xi ħaġa oħra, fuq support in the community wkoll, ma nafx tipo Malta fil-istrateġi xpjanata. Naf li barra minn Malta in the UK partikolarment hemm l-option li inti tista' jew ikollok is-servizzi offruti mill-gvern jew inkella jkollok financial support u inti tażel is-servizzi, you can have private services imma jkollok il-financial assistance xorta. Ma nafx jekk biex ħadd tkunx addressed bħala.
Le, il-differenza bejn Malta u l-Ingilterra, UK, ma ħanitkellmu fuq l-Ingilterra fuq l-Ingilterra naf il-figuri eżatt, hija li l-Ingilterra lonċew l-istrateġija tagħhom xi wieħed u ieħor xi sentejn ilhom. U tefu ġew fiha 750 miljun sterlina li jiġu madwar biljun euro. Aw Malta nippruvaw nagħmlu strateġija, nassikurakom li l-istrateġija ħassir b'xejn. Sewwa, u ma nafx kemm se jkun hemm the financial input with respect to implementation. Dik li naf ngħid. Li naf ngħid ukoll hija fuq Franza li meta lonċew l-istrateġija tagħhom fit-2010 date, apparti li kellhom ħafna affarijiet tajba fiha, qalu dina ħadd iswina 1.6 billion u 1.6 billion tefgħu fiha. Jiġifieri apparti li jrid ikun hemm commitment minna għax aħna kollha naħdmu f'das settur. Commitment minn ħafna nies inkludi l-policy makers il-politiċi, jrid ikun hemm commitment ukoll finanzjarju. Dana huwa kollu u għalejda bil-Malti di ħatibmun da li qed nagħmlu huwa kollu paroli fil-vojt jekk ma jkunx hemm commitment finanzjarju. Hemm affarijiet żgħar li jiġu min-naħa tagħna personalment u nistgħu nirranġaw is-sitwazzjoni bihom li ma jiswewx flus aħna fil-post tax-xogħol tagħna, we can increase awareness, we can increase the level of care, we can enhance the dignity of the individuals, because we do this particular type of work. But again, it has to have a financial commitment. Pero jena ngħid li intom l-imsiemer, intom it-tnalja, intom the tools to be there, out there, and actually be the voice of what we are trying to do in terms of enhancing dementia care and management here in Malta.
Gertrude Buttigieg, Office of the Commissioner for Mental Health and Older Persons. Basically, waħda mill-affarijiet illi bħal uffiċċju edha in the pipeline huwa nixtiequ illi naraw age-friendly cities u Malta. Age-friendly cities. Fatt qed nillanċjaw anke kuntatti mal-local councils. Għadna fil-bidu, imma it's one of the way forward li naħseb anke tidħol ma' f'din l-istrateġija. Fil-fatt għalhekk il-biraħat lek probabbli nkunu qed inħabtu naqra rasna ma' xulxin. Issa jiena nemmen illi għandna ħafna deġa resources in place. Ma nafx hekk hemm ġilsib li forsi jsir xi tip ta' stock taking. Per eżempju, naf illi jingħataw lectures lil carers mill-MCAST. Jingħataw lectures l-università. Jingħataw training f'postijiet differenti. If we take stock of what is already happening and maybe see that quality is put into it, ma nix għalfejn nerġaw ninvestu l-flus fl-edukazzjoni.
Nafazax id-dejta x'parti mill-eżerċizzju kien li naraw x'tip ta' edukazzjoni qed tiġi offruta u sibna fragmentazzjoni kbira ħafna, ġifieri sibna fragmentazzjoni kbira fl-università let alone meta ħadniha fuq sitwazzjoni nazzjonali din. U l-biża' tiegħi hija l-standard of training li qed jintuża. Jiena iktar iħabbilli rasi the material that is being